For centuries, it was one of the deadliest diseases on Earth. Even today, despite modern medicine, millions of people are infected every year. It usually attacks the lungs, spreads through the air, and can remain hidden in the body for years before causing symptoms. This disease is called tuberculosis, often shortened to TB. So what exactly is tuberculosis? Tuberculosis is a bacterial infection caused by a microorganism called Mycobacterium tuberculosis. It most commonly affects the lungs, but it can also spread to other parts of the body, including the brain, kidneys, bones, and spine. TB spreads through the air when an infected person coughs, sneezes, speaks, or sings. Tiny droplets containing the bacteria can be inhaled by people nearby. However, not everyone who is exposed becomes sick immediately. In many cases, the immune system is able to contain the bacteria. The bacteria remain inside the body in an inactive state known as latent tuberculosis. People with latent TB do not feel sick and cannot spread the disease. However, the bacteria can become active later in life, especially if the immune system becomes weakened. When TB becomes active, it begins to damage lung tissue. The immune system responds by surrounding the bacteria, creating areas of inflammation and tissue destruction. This can interfere with the lung's ability to exchange oxygen properly. Common symptoms of active tuberculosis include a persistent cough lasting several weeks, coughing up blood, chest pain, fever, night sweats, fatigue, weight loss, and loss of appetite. Because these symptoms often develop slowly, some people may not realize they have the disease until significant damage has already occurred. Tuberculosis has affected human populations for thousands of years. A major breakthrough came in 1882 when Robert Koch identified the bacterium responsible for the disease. This discovery helped scientists develop diagnostic tests and treatments that dramatically improved survival rates. Today, TB is both preventable and treatable. Treatment usually involves a combination of antibiotics taken over several months. Because the bacteria grow slowly and can become resistant, it is essential that patients complete the full course of treatment, even if they begin to feel better. If left untreated, tuberculosis can cause severe lung damage and may spread throughout the body, becoming life-threatening. It remains a major global health challenge, particularly in areas with limited access to healthcare. Today, artificial intelligence is helping doctors detect tuberculosis more efficiently. AI systems can analyze chest X-rays and CT scans to identify patterns associated with TB, often within seconds. In regions where radiologists are scarce, AI-assisted screening tools are helping healthcare workers detect possible cases earlier and refer patients for testing. Researchers are also using AI to study drug resistance patterns and improve treatment strategies, helping healthcare systems respond more effectively to this disease. Tuberculosis is a serious infectious disease that primarily affects the lungs, but can impact the entire body. Understanding how it spreads, how it develops, and how it is treated highlights the importance of early detection, proper treatment, and public health measures that continue to save millions of lives. But some lung diseases are not caused by infections at all. In our next video, we'll explore lung cancer explained and discover how abnormal cell growth can develop inside the lungs and threaten the body's oxygen supply.